Hello, welcome to this week's Lunch and Learn webinar for small ruminants. I'm your host, Sarah Jamansky, Extension Educator for Agriculture and Natural Resources with Purdue University Extension. And joining me today is my colleague, Mary Rodenhuis, who is also an Agriculture and Natural Resources Educator with Purdue Extension. And I'll let her start off the presentation today and she can introduce herself.
Hi, everybody. I want to thank Sarah for letting me join you guys today. Like she said, I'm the Ag Natural Resource Extension Educator in Franklin County, so the southeast part of the state. I've been raising lambs for about 9 years now. My boyfriend and I have wool sheep. We've got Hampshires, Dorsets, and Southdowns. So, again, please feel free to ask any questions. We'll try to do the best to keep up with those questions as they come through, and we'll get started. So the best part, I'm always about being prepared. We always like use to operate on their own schedule. I'd like to use to tell me, when exactly they're going to be lambing to make it easier on us to fit in our schedules, right? Um, but they operate on their own schedule. But there's a lot of signs that for us to be prepared for, to be looking at. Then we're always having our toolbox and our supplies ready so that when our ewes and does start having babies, that it doesn't take us by complete surprise. So the first thing, to be not surprised, we have to know when to expect babies to land on the ground, right? So gestation for our small ruminants, it's about that 150 days, plus or minus 5 days. You know, um, about in there is about when we start looking. It can go a little bit earlier than that. They can go a little bit later. It just depends. A lot about genetics. And so if you keep good records, you can also keep a really good track of when a ewe generally is in her gestation length and when to expecting if she's going to go late or early. Um, but in order to know when to be expecting, we have to know our records on our breeding dates. And so there's a couple ways to do this. Hand breeding is the best way to have 100%, complete records. So hand breeding is when you have something tell you that your does or your ewes are in heat. A lot of times this may be a teaser buck, a teaser ram, so a ram that's still intact but has been surgically castrated, and so they'll still pick up on the hormones and do all of the acts as our normal rams and bucks, and just indicate that our ewes and our does are coming into heat, and then you take those ewes or does and put them with the buck that you want them to be breeding with on that certain day. Um, this is a little bit more management or time on our hands. And so if you don't have the capability or you don't have enough pins to be able to do that, using a marking harness when we have bucks out is going to be key in kind of getting a pretty accurate date on when those animals got bred. So the marking harnesses, they go around their chest. You see that top middle picture there of those green and the red crowns that gets put on that marking harness. And then when they go to breed that animal, the dam, it leaves a nice colored mark that you can see and be able to write down that breeding date. It's really important to keep really good, accurate records, to do this at least once a day, if not twice a day, so we know exactly when our ewes or our does are getting bred, so that we can have those records to know when to start expecting babies. It also is really important if you switch rams to switch the color of the marker that you're using so that you know exactly who that animal is bred by. We also like to switch our markers every 21 days or every heat cycle so that we know exactly when they're getting bred. If they recycle, it's a different color if they're getting rebred again. So that's an easy way to pick that difference up and to be able to view that from a far distance. One problem with
Mary,
yeah, go ahead, Sarah.
we have a question from one of our listeners. It's, will marking harness ruin the wool from wool breeds?
Yeah, so that's always a potential. It makes that indentation there. Um, However, with our rams, that wool quality, because of all the secretions and that they have, it can damage it anyway. So our rams, that we don't necessarily get good quality wool out of them necessarily either. But yeah, it can damage that wool because it can kind of make that a different color. And so that is a possibility. So if you have that concern, hand breeding might be the best case to go. If you're worried about that marking harness, another thing you can use is called rattle powder. It's that bottom blue bucket there. This will definitely discolor the wool on your sheep, though. So if that again, that's a concern of yours, you probably want to stray away from this. That rattle powder is a powder you mix with like oil, so vegetable oil, canola oil, and then you hand apply that. To the chest area. And so once that ram is breeding the females, or that buck's breeding your females, it passes some of that powder onto the same area. The biggest downside about rattle powder is that it is more labor intensive. You have to reapply it to make sure you're getting that the transfer of that product to our ewes and our does, and it can get pretty messy. It gets all over your hands, so I suggest wearing gloves. But that's an option if you're worried about, the marking harness or getting caught on something, getting a leg, caught up in there somehow. It's a way you can go on the rattle powder there. And again, just keep those records. Keep track of the day you see color. Even if it's just a little bit of color, you think maybe that's a false jump. Keep write that mark down. Write it was a light mark, and then you'll know if she gets remarked again in the future. You can have those exact dates. And then always keep track of when you're putting rams out into the pen with the girls, and then bringing that back up or switching rams, so you know exactly what date they started. So after we get those bred, we know kind of when we're expecting our due dates to happen. There's the key health checks we should be doing. So in our ewes and our does, about 30 days out before lambing or kidding, we should vaccinate with CDT. We have a picture of that bottle there in the bottom right corner. This helps pass along the immunity to the lambs and the kids through the colostrum when they're first born. And so making sure we get them vaccinated before lambing or kidding is key to that new lamb or that new kid's health. If you have a first-time mom, they suggest doing 2 doses, so hitting them at 6 weeks and then again at 3 weeks before lambing or kidding would be essential to building up that immunity in the colostrum. You also want to check FAMACHA scores to make sure we don't need any deworming at this point. In order to do that, you look at the eyelids. We're going to have a segment in a few more weeks about parasites and deworming and things like that. So come back if you're interested in learning more about FAMACHA score. This is especially important if you're lambing during warm seasons, to where those using those does could pick up more worms. And you want to make sure when they're pregnant, you're not using valbazen. That'll cause abortion. So use a different wormer other than valbazen. If in your
Mary,
yeah.
we have another question from a listener.
Okay.
If they already had a CDT vaccine this year, but before being bred, do they need it again?
Yes. So you want to do it about 30 days before you're kidding or lambing, because that'll build up in the colostrum. Then if you have it beforehand, it's not going to be, you're not going to have the concentration in the colostrum to be effective um, in your kids or your lambs. All right, so for the CDT, you give the mom the full dose both times if you're doing the 6 weeks and the 3 weeks. Again, that's just building up that in their system, especially if they haven't had multiple doses before. So they're their first time lambing or kidding, it just builds that up in the colostrum. Good questions. Good questions. If copper bolusing is a part of your routine, again, that's going to be in goats only. We don't want to add any extra copper for our sheep. It's a good time at this point to go ahead and administer that copper bolus. And that while we're kind of checking, we've got them collected, and we're checking them over, and we don't need to be handling them multiple times. Again, you've got them caught. Go ahead and check their feet and hooves. Make sure you don't need to do any trimming. Get those cut back, and make sure that we're not going to have any lameness issues. What is the full dose? I would have to read the bottle. I don't have the bottle in front of me. Read the bottle and dose of what this says on the bottle to do. We typically we actually do about a half a cc with our lambs, and we can get to this later too, but we don't vaccinate our ewes just because of getting that timing just right. So we vaccinate when our lambs are born. So we'll do a half a cc when they're born, and then a full cc later when we're banding.
Mary, we have another question.
Okay.
Can you do CD&T and deworm and shear in one day, or will that be too stressful?
It depends on your flock's, how calm your flock is. Typically, that's what I would suggest. Try to get it done and knocked out all in one day. But if you have a flock that's highly stressed, or that you don't handle very much, things like that, it could be a lot very stressful. Typically, though, in that last kind of 30 days, we don't have as much concern about, you know, that high of stress causing like abortions like we would in those first 30 days of pregnancy. But if you've got a flock that's really flighty, and catching that you're noticing a lot of stress, try to cut that back. You also don't want to do then like 2 days back to back, because those animals still haven't necessarily calmed down from the first day. So I would suggest probably a week kind of between handling, especially because if you have a kind of a flighty flock. We had another question. What days do you vaccinate the first time mom? That would be 6 weeks before your lambing or kidding date, and then 3 weeks ahead of time of lambing and kidding. A couple days before your due date, you want to clean up your ewes and your does to make sure that you just get rid of any extra hair, any extra wool. You can do this, trim the bellies, trim up the udder, trim up around the vulva, so that's a nice clean environment. Again, you've got them caught. Check your feet, make sure you don't have any extra growth. And at this point, you can move them to a birthing pen or a jug pen, depending on your operation. On our farm, we let our ewes drop in our general population, and so we're checking quite frequently, making sure, especially getting close to those gestation, those lambing dates. We go and check, and then once that lamb is dropped, mom's got a chance to clean her off. Then we put her into the jug pen to give them a chance to bond. For us, it works in our system. We have a general population of all pregnant ewes. The cons to this can be if you have multiple ewes or does kidding, lambing at the same time, they can try to claim each other, it can kind of get confusing. But it also is a good indicator, if you've got a mom, one that's still pregnant, trying to claim another lamb, it's a good indicator that she's getting close to starting, or she's kind of in that pre-labor term as well. The biggest benefit for us to be able to keep them out in general population is it keeps them in a bigger area so that they have plenty of area to move around and exercise, and to help labor keep progressing. So if you've ever had, I haven't had kids, but if you've ever had kids, getting up and walking around the hospital can really help labor progress. And that's the same scenario for our does and our ewes. They need that room. They need to be able to get up and exercise and keep things moving. And so if they're in the jug pen already, it can kind of slow labor a little bit. And also can lead, if you have them in there for too long of a period, and they're not moving and exercising, potential to put on a little too much weight, and risk the chance of ketosis. And so there's pros and cons to both, but for us, we found that it works pretty well. But again, you have to be out checking quite frequently, making sure if you're finding animals. We also at night we lamb between November and March. So in the cold at night, we make sure all of the ewes are locked up in the barn. There's plenty of space in there, but that way they're not out in the mud or the snow, potentially trying to give birth out there too. So you've got to kind of set up your system to what works for your operation. But at this point, if you're going to be putting them into jug pens, you don't want to go about 3 to 4 days ahead of time. That due date is a good time for that. Any other questions? Okay. All right, so we have a toolbox that we kind of keep a lot of this stuff in. That's our kind of our go-to. It's in the barn. It's where all of our lambing and or kidding stuff is. And so for mom, some of the things to have on hand is going to be ketone strips to help diagnose ketosis. If you've never experienced ketosis, it can be a fatal disease. Or if you've heard of pregnancy toxemia, that's ketosis. You can also diagnose this by a sweet smell. If you have Sarah's going to talk about ketosis a little bit more in depth, but if you have a ewe or a doe that you're suspecting is potentially ketotic, you can smell their breath. And if it's sweet, that's an indicator they're in ketosis. Always have propylene glycol or Nutridense molasses Karo syrup on hand. That picture of Power Punch there in the corner, that has propylene glycol and molasses all in it. That has a treatment for ketosis, and also if you've got a weak ewe or a weak lamb, we can give that to kind of help perk them up. If you have a calcium deficiency or milk fever, have Tums is an easy way to get some calcium to those ewes. Have a syringe and needle in case you need to administer anything. The dosing syringe without a needle or that kind of drench gun there, that's what we use to admit the Power Punch there to the ewes. It's an easy way to get it down into their throats. And then always have your number of your vet on hand in your house, in your phone, in your barn. Write it down multiple places so that everybody can have access to it and find it relatively quickly in case you have an emergency situation. Go forward, Sarah.
Well, we have a couple of questions.
Oh, okay.
Yeah, so.
Okay, so I see one is, do you pop Tums in their mouth? We will actually crush them and then put them with a little bit of water and bring them up in that syringe and get them back in their throat to ensure that it gets back and gets administered to them.
And as far as dosage, work with your veterinarian because
Yes.
it's going to differ depending on the animal.
Yeah, definitely.
And then some of the other questions we have, we'll get into that a little bit later in the presentation.
Okay. For our lambing and kidding supplies, you want to make sure you've got fresh, clean towels out there in case you need to get down there and clean up the animals or warm them up quick. You have betadine, chlorhexidine to help clean up mom or to dip navels. It's always good to have some exam gloves. I know they're kind of hard to find right now. We always order a box or two and keep them on hand in case you need to assist or go in and check on mom. Additionally, you want to lube. You want to always make sure that you're using lube whenever you have to go in and assist or check, just to help make sure you're not going to be doing more damage to that area. A flashlight or a headlight is good to have in case you have dark spots or you want to go check the barn real quick without turning all of the lights on and disturbing all of the animals. Injectable oxytocin, that's going to be for any retained placentas, or if you have a ewe or a doe that you've noticed isn't progressing as quickly as she should be. So the oxytocin is basically going to stimulate contractions, and so that'll help if your dam hasn't passed her placenta totally. It'll help with the contractions and pass that placenta, or again, if they're stalled labor, to help get that process going again. You want to make sure though that you're 100% sure that you or that doe is in labor before you do oxytocin. So So you're not, inducing that animal when she's actually not ready or in full labor yet. So if you're not sure about that, contact your veterinarian. They may come out or tell them exactly what's going on, and they can help you make that determination if you need to use oxytocin or not. The hemostat or umbilical clamp are good if the umbilical cord isn't quite clamped off yet. You need to make sure that your infection is going to get up there. Or in the puppy training pads, it gives you a disposable area that can be kind of clean, especially if you need to be warming that animal up or tubing, things like that. And then you can just throw that away. You don't have a towel or something that kind of wet and damp, but it helps create a nice clean surface. For newborn care, if all of these things are very important, but the lamb tube is especially important, especially if you have a weak lamb, one that can't get up and nurse on its own. Having that tube there to be able to get colostrum or milk to it is key. So that's that picture up in the top left picture. It's a big syringe basically and a tube on the end of that. The Pritchard nipples are there on the left bottom picture. Those go on most of our empty soda bottles. So keep your soda bottles instead of recycling them. So you have those in case you need to bottle feed. That's really the best for young, newborns getting started. And can work as you get a little bit older if you have a couple, one or two bottle babies. If you have a dairy goat operation where you're bottle feeding a lot of kids, then obviously you're going to put them on a bucket or something like that. And we've got a picture of something like of that later on. It's always a good idea to have colostrum on hand in case you have a mom with the hard udder or won't claim or things like that, or if that you dies while giving birth. Having colostrum on hand is going to be important to getting that immunity started in that baby. And this could either come from milking out a mom that has extra, maybe she lost a lamb or she just milks really heavy for one lamb or kid. You can milk her out and freeze some of that extra colostrum, or having colostrum supplement or replacer on hand is important too. Same with milk or milk replacer. It's really important though to know what you're buying. So colostrum and milk supplement is for supplementing that animal. So they're getting a little bit from mom, they just need a little bit extra. That's where the supplementation occurs. If you are trying to replace their colostrum or their milk completely with a supplement, they're not getting enough nutrients in there. So you need to make sure that you find a colostrum or a milk replacer. So reading the bag, reading the label, make sure you know exactly what you're buying so that they're getting the proper nutrients when they're born. Having something to heat them up is going to be important. So a hair dryer, heating pad, hot water bottle. With the hair dryer, make sure you're not doing direct heat onto the skin because you can burn them. So we like to wrap a towel around the lamb and then get the hair dryer under there, kind of blow it up and get the hot air kind of surrounding if you need to warm it up. The bulb syringe will be for clearing nasal passages. Having a thermometer and stethoscope will be important for just kind of watching the temperature and making sure the lungs are clear of any fluid. When we look about our birthing pen, we want to make sure it's a clean and a safe space. These pictures are a really good example of a nicely constructed birthing pen. You want to make sure, especially if you're lambing or kidding in cold months, that you're indoors, you're out of the wind and any rain or snow, but you also have good ventilation to make sure you're not getting respiratory issues in our newborns. So making sure we have fresh air coming in, but not drafty and windy on those newborns. That'll make them cold pretty quick. Go ahead, Sarah. The pens, you need to make sure that they're big enough so that the animals can stand up, kind of move around without touching either side of the pen. Depending on the size of your animals is really going to determine that. Typically, we see about a 4 foot by 5 foot, or if you have like a bigger framed sheep, a 6 foot by 6 foot. But test that out if you're building your own pens. Measure out or stick one of your ewes in there, one of your biggest ewes in there, making sure they can move around comfortably and be able to just move around and not be cramped and tight. It'll be really important for your birthing pens, especially if you introduce your doe or your ewe in there before lambing or kidding, and making sure they can't accidentally drop the baby into water or the food pan. You don't want them to accidentally get into the water that the baby can't get out, mom can't get it out, and then you have accidental drowning. So making sure you're really thinking about where those are placed, or making sure they're placed out of the way so that you don't have that accidentally happen. And then when we talk about bedding, the biggest thing is making sure we don't have too small of particles to get really, stuck on that lamb or the kid, or to get up into the vulva area and cause infections for our mom. So clean straw is a really good option, or if it's warm enough, you can get, they're outside, a clean grassy area. Try to avoid sawdust or really, really fine particles. Bare soil, dirty straw, manure pack, again, all those things are going to increase the chance of infection in our ewes and our does. And so making sure it's a clean, healthy environment. What Sarah does is she puts the shavings down to help absorb extra liquid, but they can be kind of small and stick to lots of things. So then straw on top of that to help keep it a clean environment. And so, or you can do just straw depending on how your barn is laid out. And where you're lambing or you're kidding. But again, keep those animals clean and decrease the chance for infection going on.
Okay, so now we're going to switch over, and I'm going to talk about how do you know when your ewe or your doe is ready to lamb or kid. And so there are various ways you can know. The first thing is know if they're pregnant at all. So there are various pregnancy test options available. Probably the easiest one is using a blood test. This can be done approximately a month after breeding. And then you would, with a blood test, you would draw the blood, either you or your veterinarian, but this is something you can do at home if you learn how to draw blood. And goats and sheep are the easiest animals to draw blood on of any species. They really are the easiest to draw blood on. There are urine tests that are available, but you have to wait a little bit longer. So you're going to be waiting 50 days for a urine test. And then for those who raise dairy goats, if you are doing DHI testing, some of the DHI labs actually provide pregnancy testing on the milk. So you can do these pregnancy tests, but some things to keep into consideration is if you send it too early, then you could get a false negative. If you have a doe or a ewe that was pregnant, but then she resorbs the fetus dies early, you can get a false positive. So pregnancy tests are not going to be 100%. We do have a question back from our previous slide. Can you use pine flakes for bedding? This is what Mary was talking about. You can use pine flakes, but they are a little bit small and they can stick to things. And so if you're going to use pine flakes, prefer that you use something over them, such as straw, newspaper, or something else that can cover the pine flakes. So another way that you can check for pregnancy is by looking at physical signs. Some animals are going to develop physical signs earlier than others. The first sign you're going to see is that the estrus cycles will stop. And so typically you're going to see 13 to 19 days on sheep and 18 to 21 days on goats for a cycle. And so if you get past that window and you don't see a cycle, there's a good chance that she's pregnant, but it depends on the time of year. Dairy goats are seasonal breeders, and so if you were to breed in February and she didn't come back into heat, it may not be because she's pregnant, it may be because she's just stopped cycling for the year. So that's not going to be 100%, but it is a good way, especially if you're earlier in the breeding season, to tell if they're pregnant. You start to see your other physical signs of pregnancy about 60 to 90 days into gestation. So typically the first sign that you're going to see is the vulva is going to start to swell and become soft. And this is because you have relaxin that they're producing, that they're getting ready to kid. And so as they go farther into pregnancy, the vulva is going to get bigger and softer. And you're also going to see udder development. And udder development is going to be different on different animals. Typically, if it's an animal that's never lambed or kidded before, it's a pretty good indicator because they'll start developing their udder fairly early. If you have one that's lambed or kidded before, though, they very well may not develop their udder until the day before they kid or even the day of kidding. And so it's not as good of an indicator as the swelling and relaxation of the vulva. And so you can see that image on the right side that shows a swollen vulva. And then a sure way to know if they're pregnant is by using an ultrasound. And then it also offers a way to count the number of fetuses. And so ideally, you would use a transabdominal B-mold ultrasound 35 to 90 days post-breeding for sheep and 40 to 75 post-breeding for goats. And so ideally 65 to 70 days is going to give your best shot. So if you look at the bottom left picture, that is an ultrasound of a fetus later in gestation. You can actually see the spine of the goat. There's also the option of a preg tone. It's not going to be as exact, and it's going to be a little harder to use. And so it's not going to be as accurate as an ultrasound. But the top right picture, that is an example of a preg tone unit. So that's something that you can use kind of at home, and it's a little less expensive. Okay, so we have a question. I have one that hasn't kidded and neither show udder development at 2 weeks out. Both have had a positive ultrasound when we feel babies in there. So udder development can be as little as the day of kidding, or it could be as soon as the day of kidding. So udder development isn't your best gauge of when they're going to kid. There are other signs that are more accurate. And so the swollen vulva is a good sign that they are pregnant. And then we'll look at some other physical signs that they're getting ready to kid. So one of the biggest or the most important signs is right around the tail head. So about that last month of gestation, we're going to see the tail head start to raise above the pin bones. And there will be a ligament on either side, so it'll kind of make a triangle from from toward the hips down toward the down toward the pin bones and the thurls. And so there will be ligaments on either side. About 24 hours before that ewe or that doe is going to give birth, those ligaments will disappear, and that's the relaxin doing its job. And so you'll have that raised tailbone, you'll have the ligaments on either side. Watch for those ligaments to disappear. When those ligaments disappear, then you need to be able to watch her really closely. Now the picture of the ewe down at the bottom, she's already lambed, but you can see really distinctly that tailbone up above the rump and how those ligaments are totally gone. It takes a little while for that to go back down after lambing or kidding. So that's one of the biggest pre-labor signs. So again, the udder development may start early in pregnancy, particularly with your first fresheners or your first kidders, your first lambers, first time. But you're going to see rapid changes right before lambing or kidding. There are some that they may not fill up. You may not even see an udder until the day of lambing or kidding. What you want to look for is the udder filling with colostrum and not just tissue. And you can have some that'll put a lot of tissue there even, well before lambing or kidding. And so some could be a month before where they're developing the tissue. Some can even put colostrum in a month before. So, but if you see a sudden change in the size of the udder, that's an indication that labor is going to start soon. So in stage 1 labor, so this is the first part of the birthing process, you're going to, not always, but often you're going to see a full and shiny udder, especially if you see a sudden change in the udder. You will likely see clear to slightly cloudy mucus discharge from the vulva, but you can see mucus even weeks before labor starts. because this is the start of the cervical mucus that protects the fetus from being expelled. And so this can start even a week or more before labor. But when you start to see more mucus and you start to see kind of a steady mucus discharge, it gives you a good clue that labor is starting. And then in early labor, you'll see some mild contractions. So you might see her stand up. You can actually watch sometimes as the contractions go through their body. And so she's going to get up and get down and paw at the bedding. She's going to be uncomfortable. And so you will see stargazing. So stargazing, they're kind of rolling their head, kind of looking up. You'll see grunting and groaning. You might hear them grinding their teeth. And you'll hear grunting and groaning pretty much any time in the third trimester. They tend to see, they're very uncomfortable, especially if they're carrying a heavy load of kids. And so the early labor can last anywhere from 1 to 12 hours. If it lasts more than 12 hours, you might want to think about contacting your veterinarian because there might be some reason that labor stalled, maybe malpresentation or something. And so here we have a video of a ewe that is in the early stages of labor. So you notice how she had her head up and then put it back down. So that was an example of stargazing. Here she goes again. So head up, head down, stargazing. She's getting up. She just kind of looks a little bit miserable. Hear the kind of the grunting and groaning. She's pawing. Okay, so we have a question. What is a trimester? A trimester is 1/3 of the pregnancy. So pregnancy, if we talk about human pregnancy, lasts approximately 9 months. And so a trimester is approximately 3 months with a human. With a goat or sheep, when you have a approximately 150-day plus or minus pregnancy, you're looking at about a 50-day trimester. And so we see more kind of stargazing. She got back down. She's rolling over. So these are different signs that you commonly see in a ewe or a lamb that is in early labor. Okay, so from early labor, we move to active labor. So this is our stage 2 labor. Stage 2 labor, we're going to see a much thicker string of mucus appear. And so that's the bulk of the mucus plug that's being expelled from the cervix. You may see this happen in early labor, but often you're going to see this right at the start of active labor. And so from, where you saw a little bit of mucus just kind of steadily dripping before, now you're going to see this long string of mucus that's going to go down, from her vulva to the ground often. You're going to see her actively pushing. So she may squat to give birth, she may lie down, or she may go back and forth between those positions during active labor. And so usually within about 30 minutes of pushing, you're going to see the amniotic sac. And so once you see the amniotic sac, you should see the nose and 2 feet. And usually you're going to see the feet first and then the nose following shortly behind. The kids or the lambs should come within 30 minutes of each other. If you see more than 2 hours from the time you have active pushing and there's no sign of a lamb or kid, you probably need to check and see if she needs assistance. Because if she's actively pushing and nothing's coming out, there's something wrong. Okay, so how do we tell if she needs assistance? Well, let's go back to some of the pregnancy problems that we could see. So vaginal prolapses will happen usually in the 3rd trimester, so the last 50 days or so of pregnancy. They're more common in sheep than they are in goats, but they can happen in goats. And the photo that we have is of a Nigerian dwarf goat. And so they're often caused by the increased pressure inside the abdomen because you have a larger uterus. And so it's putting pressure on the vagina. And if the vagina has weak attachments, then it can be pushed actually out of the body. So if you have a lot of fat in the abdomen, you have a distended rumen. So the rumen, which is the largest part of the stomach, is very full. Plus you have the full uterus, and then you have the relaxation of the pelvic girdle because of the pregnancy hormones. All of this can lead towards a prolapsed vagina. And this can be exacerbated if you have a ewe whose tail is docked too short. And so what you want to do if you have a prolapsed vagina is you're probably going to want to call your vet because they'll need to apply a local anesthetic to the organ that's outside of the body. Then that will need to be washed with a disinfectant and then replaced and sutured. And you have to make sure that you remove that suture before they give birth. Or instead of suturing, you may use a prolapse retainer, and that's what's shown in the bottom picture. So that's actually stitched to the ewe or the doe to keep that prolapse or to prevent that prolapse from happening again. And typically, if you have this happen in a ewe or a doe after she gives birth, then and raises the lambs or kids, you want to cull her, because if it happens once, it's going to happen again. And so this is not one you want to keep in your breeding herd.
Yeah, a lot of times our prolapses are going to be genetically linked, and so once it happens once, it's more likely going to happen again. And then you don't want to keep any ewe or ewe lambs or doe kids out of her because it's going to be passed through that trait.
Okay, so we had some questions earlier about ketosis. Ketosis and pregnancy toxemia share a lot of the same symptoms. But in general, what we want to watch for is we want to watch for them to go off feed. If they go off feed, if they're lethargic, if there's edema in the front legs, these are all signs that there's something going on metabolically. So there's a metabolic problem that we need to address. And so what happens, how this happens is because she's not eating, she's metabolizing fat because she can't meet the caloric needs of her rapidly developing fetuses. And so there are a couple of different reasons why this could happen. One could be that she's severely overweight, and so she has limited room in her gut to be able to actually consume the amount of feed that is necessary to feed these fetuses. Another thing is that she could be very underweight. So both severely overweight and underweight animals are most at risk. And so for one reason or another, they're just not able to meet the needs through their diet of the fetuses. And so when you have multiples, particularly triplet males, that's when you're most likely to see this. And so ketosis is going to be most common in a doe or a ewe that's carrying triplet bucks or triplet ram kids or lambs. And so for prevention, the biggest thing is to maintain body condition at an appropriate level. So we want to see our ewes and does at a body condition score between 3 and 4, somewhere in that range. To me, the ideal body condition at the time of lambing or kidding is a body condition score of 4. You do not want them any higher than a 4 because then you're at a higher risk for ketosis. Now, if they're at a 2, they're also at a higher risk. And so you want to make sure that you provide high quality feed that provides enough energy and to make sure that they continue eating. And so if you're seeing symptoms appear, then you're going to start with treatments. And so dosing 2 to 3 ounces of propylene glycol 2 to 3 times a day will help prevent ketosis. And then calcium, so calcium deficiency can also mimic this. And so treating with calcium, you should see a rapid improvement. If they don't improve with calcium, then that's when you definitely are going to consider the pregnancy toxemia or ketosis. And the ketone strips also, so you're going to use those in their urine to be able to determine if they are metabolizing and producing ketones. And so really the best
There was a question on why there's more prevalent in males.
typically they're bigger and they have higher caloric demands than female lambs and kids. And that's why we typically see it with male lambs and kittens. And again, it's the demands that they have on their mother's body. They're just harder on mom. That's what it comes down to. Is they're harder on mom. Okay, but really the best thing to do if you're late enough in pregnancy is to induce delivery. You will notice that once she gets rid of that load of lambs or kids, that she will improve very rapidly. And so if it's late enough in pregnancy, inducing delivery is the best treatment for ketosis. And so, okay, so calcium deficiency, it can be called milk fever. And so the symptoms are very similar to pregnancy toxemia or ketosis. They also occur typically within the last few weeks of gestation. And again, it's most common with multiple fetuses. So you have a lot of the same predisposing factors. This is caused by low serum calcium with a high calcium demand. So again, you have a heavy load of kids or lambs where they have a high demand for calcium to be able to build their bones, and the mother just can't bring enough calcium out of her own bones to give to them, and she can't bring enough out of her diet, and so she has low serum calcium. And so to prevent this, you want to make sure that she has calcium-rich foods such as alfalfa in the diet. And now, so what you're going to do is earlier in gestation, you're going to limit alfalfa in your high protein feeds because that can lead to large lamb and kid size. But once you're in the last few weeks of pregnancy, you want to reintroduce your legumes such as alfalfa that have a high calcium content and higher protein back into the diet. And then if you're going to be lambing kidding in the winter, you want to make sure you have enough vitamin D in the diet. Because vitamin D is related to calcium absorption. You want to make sure that you're monitoring their feed intake. So if they're not eating a whole lot of food, you want to make sure you're supplementing calcium. And then if you do see symptoms, then intravenous calcium, they will perk up pretty much immediately. You could have one that's down, you give them intravenous calcium, they'll immediately recover. So that's one way that you know it's this and not ketosis or pregnancy toxemia.
You can overdose in calcium though, too much. So if you're doing intravenous calcium, make sure you're working with your vet so that you're not providing way too much calcium.
Exactly. Anytime you're going to be doing something intravenously, I would strongly recommend working with your vet. And, with anything that you need to dose, work with your vet on the dosage.
Mhm.
Okay. Okay, so a question, if you run out of alfalfa hay, you could use alfalfa cubes or alfalfa pellets instead of hay. So as long as you have a calcium, the key is you need a calcium and protein source in the diet. The protein source is important to have so they have some resistance to the parasites at the end of pregnancy as well. But some kind of calcium and protein source is important at the end of gestation. So it could be through alfalfa pellets, it could be through alfalfa cubes. It doesn't have to be hay.
Clover is also a good, legume to feed as well. It's got a lot of similar attributes
Right.
like alfalfa.
Yeah, clover is very similar to alfalfa in the composition.
You want to make sure you're planning out your forage all throughout your breeding season and your gestation to making sure that you keep that high quality alfalfa and stuff for late gestation, early lactation period because that's when those ewes and those does really need it. So um, kind of watch what you use the year before. If you have about the same number of animals and making sure you have that amount stocked up going into gestation will be key in making sure you don't run out.
Okay, so if you're letting them out in an area with a lot of clover and grass, that's a possibility. You just want to make sure you don't introduce that too quickly because then you can have other issues, metabolic issues such as bloat, because you don't want to introduce that kind of stuff too quickly. So I would limit feed them on that, maybe 2 hours a day. Okay, so should she be induced? So there are a few situations where you might want to induce parturition, so induce lambing or kidding. So You want to make sure, and this is where keeping your breeding records is so important. You want to make sure that it's been at least 144 days since breeding. And if she's showing signs of pregnancy toxemia or ketosis. So she has swollen legs, she's not eating, she's just acting off. And it's been at least 144 days, then yes, go ahead and induce. Or if it's been at least 144 days since breeding and you're anticipating problems and you want to make sure that you're going to be present at the birth. So if you have one, maybe it's a birth after a C-section, or you have one that is extremely obese and you're afraid that the kids might get stuck, or she's had kidding problems or lambing problems in the past, you want to be there. So you can time her lambing or kidding to your schedule. That is perfectly acceptable as long as it's been at least 144 days. The other reason is if it's been more than 155 days since breeding and you're concerned about the size of the kid or the health of the doe with her going over. And so a lot of times if you get one that goes past 155 days, they're carrying a single. And if you have a doe or a ewe that has narrow hips and you're concerned about the size of it, you might want to consider inducing. Do not induce if it's been less than 144 days and the ewe or the doe is not in extreme distress, or you do not have an exact breeding date and the ewe or the doe is not in extreme distress. So the key is if it's earlier than 144 days, you only want to induce to save the doe. If it's a choice of lose her or lose all of them, then you can induce earlier. And then you can maybe take a chance with preemies. But if it's not an emergency and it's been less than 144 days, you're best off not inducing. But there are emergency situations such as ketosis where you might decide to induce early just to try to save the doe. And then it comes down to what do you value more, the doe or the chance that maybe she has healthy kids. But chances are if you have a doe that's in that much distress, you're not going to save the kids regardless. And so work with your veterinarian on an induction protocol. A dosage for you. Typically I would use Lutalice, but work with your vet on a dosage and what you should use. So there are different positions that you'll see lambs and kids in when they're birthed. The normal presentation is going to be a nose and two front feet. So typically you'll see your front feet first, then the nose following shortly behind. And so that is your normal presentation. There's no assistance needed with normal presentation unless you have a very large kid or you have a doe or a ewe with narrow hips. In that latter case, if you have a doe or ewe that has trouble kidding or lambing with a normal birthing position, then cull her. That's something you don't want in your herd or flock. And so if she has trouble kidding and there's not a problem with the position, she's not worth keeping. So here's an example of a normal birth. I give minor assistance in this, but the assistance wasn't necessary. She would have had them anyway. So here we can see the amniotic sac with the feet and the head. That popped out really nicely. And you see it's already trying to breathe, even though it's not even out of the goat. So this is a yearling doe. This is her first kidding. And so in this case, we have a kid that's a normal sized kid, but we have kind of a small doe. She can have this kid fine, but a little traction down towards the feet will help just to kind of ease it out. Sometimes the shoulders will get stuck, and so just giving that little bit of traction at the beginning to get the shoulders out, and the rest of the lamb or kid will just come out really quickly. So in most cases, a ewe or a doe will have the lambs or kids and assistance. or without assistance. Sometimes the manual guidance can make the process a little bit smoother, but most of mine actually, they just like to land, they just like to kid when I go inside. So the doe will be, she'll be in labor, I'll go inside, and then I'll come out 30 minutes later and there are kids on the ground. And so mine, they all have nice big wide hips. They generally kid on their own without any assistance. And so there are various positions. Some I don't really worry about because they're not, with minimal assistance, they can have them, or maybe even without assistance at all. So nose and one front leg. This is fairly common. You see this a lot when you have big shouldered kids. And so it's a variation on normal. And so this can be the easiest birthing position if you have a doe or ewe with narrower hips or you have a really big shouldered kid. And so then you get your shoulders where it makes those shoulders a little bit smaller for the kid to be able to come out. Sometimes, especially a smaller doe, might need a little bit of assistance, traction with this. But again, in this case, you're going to have your head and one leg. Those will come out and just kind of gently guide it down toward her hind feet. It's a pretty easy birthing position to work with. Hocks first is not uncommon. It's not the most common position, but if she's coming, if you go in and you feel hocks, again, that provides a fairly smooth way out. It doesn't take too much to get a kid out that's coming hocks first, because the hocks are, again, kind of pointy, so they come out fairly easily. 2 back feet with dew claws down. So if the dew claws are down, that means the kid is coming upside down. Again, this is not your ideal position, but she can spit it out fairly easily with, again, minimal assistance. The positions that I'd be more worried about are true breech. So tail first. It's going to be a little bit harder. You have a kind of a wider area of the kid that needs to come out. And so while they can come out tail first, you're better off pushing the kid back in and trying to get the hocks or the hind legs out first, and then it'll come on out. 2 front feet, but no nose. That's one that you absolutely have to reposition. In this case, you're going to have to push the kid back in and go fishing for the head. You need to get that nose out. And now, one thing, probably the scariest position I've dealt with, is the spine first presentation. This happens when the kid starts out in normal position but misses the birthing canal. And so if you see a doe that's in labor for a long time and she just hasn't, and nothing's coming out, you very well may have a spine first presentation. I had this happen with a doe several years ago, and I was able to, it took me a while, but I was able to reposition the kid to where I pushed the kid farther in and I was able to get the back feet out, and she came out upside down and backwards. But she came out and she was fine. And that kid survived, and the kids after her survived. Then head with no front feet. So in this case, you're going to end up with the shoulders locking in the pelvis. So in order for this to come out, you're going to have to push it back enough so you can bring 1 foot forward. So you're going to have to do some repositioning there. So it's going to take 1 foot forward in order to be able to get this kid out. If you have front and back foot coming at the same time, again, you're going to have to feel in order to be able to determine that that's what's happening. In that case, you're going to try to push it back and get the head and 1 front foot or something like that in order to be able to get the kid out. Another issue is feet from 2 different babies at the same time. And again, you can only know this by feel. In this case, you need to push one of them back. Actually, you probably want to push both of them back and find the one that's easier to get out first, kind of untangle them in order to get them out. So for all of these, if you're going to have to reposition kids, you want to make sure that you have somebody with small hands, gloves, and lube. So some signs that you're going to see that there might be a problem is if you have more than 12 hours from the start of that stage 1 labor. So if she's been acting uncomfortable for more than 12 hours, you might want to glove up and check. Or it's been more than 2 hours since she started pushing and she hasn't delivered anything. Again, glove up, lube up, and check. Or there's been more than 30 minutes in the appearance of the since the appearance of the amniotic sac or the birth of the kid. So okay, so you have an amniotic sac or you have feet, but the kid's not coming out. And it's been more than 30 minutes. So again, you're going to want to glove up and lube and check. So some signs of distress that you might see is if there's a lot more blood than what you would expect at a normal lambing or kidding. So maybe there's a blood vessel's burst or something, or you or the doe's getting really tired, or you have a really concerning malpresentation. So let's say it's been more than 2 hours since she started pushing and you don't see anything. So you go in and check and then you see something where you just really can't, yeah, that kid, there's no way that kid's coming out on its own. And so head back, head only, two kids at once, front and back foot. So those are the most concerning malpresentations. Those are the ones where she is absolutely going to need assistance.
Sarah, there's a question. Which of these poses is the most concern with oxygen supply?
So for oxygen supply, any of your rear-facing positions are going to be the most concern for oxygen supply. But pretty much anything where if the head's not coming out, if the head's back, anything like that. So you have to work fairly quickly with those. But still, I mean, even the one that was spine first that I delivered, that one, it took her a little while, but she started breathing within a minute or so of being born. But pretty much any time where the head's not there, I'd be concerned about oxygen supply if it takes too long. But especially the rear first, because once you get that umbilical cord in the birthing canal, that's going to cut off the oxygen supply. So any of the ones where the umbilical cord is not yet in the birthing canal, you still have some kind of an oxygen supply. But if they're rear facing, you need to get them out quickly because that umbilical cord is going to get cut off and they won't have that oxygen supply from the umbilical cord. Okay, so when you are manually repositioning, you want to make sure that you prevent uterine tears because uterine tears are a death sentence for that ewe or doe. It's really difficult to save one if there's a uterine tear. So you want to make sure your fingernails are trimmed and you want to cover the feet of the lamb or kid with your hands while you're repositioning because so uncut fingernails, especially if your hand is not fully gloved, but even through gloves, uncut fingernails could potentially tear the uterus. And then also the feet of the kid could potentially tear a fragile uterus. You want to make sure you use lubricant. Ideally, the person with the smallest hands is the one that's going to go in and try this. You want to wash your hands first, and then you want a glove. And so in order to put your hand in and to check, you're going to start with 2 fingers. So you're going to start with your 2 fingers in the vagina, and you're going to gently work your entire hand into the birth canal. So you might have to expand it a little bit. You might have a doe that hasn't fully dilated. So you might have to manually dilate her. And so at that point, you're going to gently feel what parts of the lambs or the kids are in the birth canal. So some things you might want to feel for. So feel for nostrils. Those are pretty easy to recognize by hand. Feel for feet, feel for the tail. So those are some parts that are pretty easy to identify even if you can't see them. And so those are kind of the body parts that I look for. The spine, if that's all you can feel, it's pretty obvious what that is. So if the head is back, you want to push the entire lamb or kid back into the uterus. And then you're going to start looking for the nostrils or the jaw. And then if possible, you're going to try to get your hand behind the back of the skull and work that head into the birth canal. So with nose first and one foreleg at least. And then once you get that head into the birth canal, then you can provide gentle traction each time your ewe or doe pushes. So you don't want to pull unless she's pushing. So you want to work with her, not against her. Okay, and so if you have a true breech, so if you feel a tail, and So if you have a really small kid and it's a true breech, then it could probably come out. But if you have a larger kid that might give some trouble, you want to push the lamb or the kid back in, and you want to work your hand gently down to the hind legs, and then gently move the hind legs up, the hind feet particularly, up into the birth canal. And then once you have the hind feet into the birth canal, just gently, using gentle traction every time she has a contraction, it should easily come out at that point. Okay, so if you have the head only, you want to push back the head and gently fish for one leg. And then again, you're going to cover the hoof with your hands and try to get that one leg and the head into the birth canal. And then use gentle traction towards the feet as she has contractions to be able to move it out of the dough and give birth to that lamb or kid. If you have two at once, you want to push them both back and then figure out which one's in better position to come out, and then get that into a deliverable position, whether that's hind feet first, whether that's one front foot in the head, whether that's normal position. But some kind of position where it can be born is what we want to do. Okay, so how do you know when to call the vet? Well, let's say she's in pre-labor. She's weak or lethargic and she's not responding to what you're doing at home. Or if she has excessive bleeding and you're not sure what to do about it. Or she's been in stage 1 labor for more than 12 hours and you check her and the cervix is still closed. So these are conditions pre-labor where you might call a vet. During labor or post-delivery or so if you have a lamb or kid that's too big to be delivered, even if you give some gentle assistance, or it's in a position that makes delivery impossible, there's just no way you can get it into a good position. And a lot of people, if they have a spine first delivery, you may very well need a C-section in that case, if you cannot get that kid positioned to where it can come out. Or it has a defect that makes delivery impossible. Early in the time when we were raising goats, we had a doe that had Cache Valley virus, and she had a kid that had locked front knees. There was no way that kid was coming out without a C-section. The other thing is if your doe is going into shock, you want to call the vet immediately. And that does happen if there's a very traumatic delivery. So here's a video of assistance, and again, this is you that probably could have had the lambs on our own, but this is an example of how you give assistance if you need to. You want to make sure that you glove up to protect your hands and to also protect the ewe or the doe. And then you want to make sure that you are going slowly, so you don't rush. So he's slowly working his hand into the vagina of this ewe. So he's finding the feet and the head to make sure they're in the right position. So we see a foot. We see another foot. So he's working with her contractions to give gentle traction to this lamb. There's a nose. And so he's clearing the amniotic sac away from the face so that it can breathe. So you want to make sure if you are going to assist, you always pull toward the hind feet. You don't want to pull straight out. You want to always pull toward the hind feet. And so if the lamb or the kid doesn't start breathing immediately, you could tickle the nose with straw to get it to take a breath. And then you want to just give mom and kid some space, or mom and lamb some space, so that she can take care of it. This is in the case where you're going to dam raise the lamb or kid. In some cases, you might want to bottle raise. If you're going to let her raise her own lamb or kid, then back away and give her some space. So what if she needs a C-section? So most of your large animal veterinarians will perform a C-section on the farm. And if it's required, you need to make sure that you have a clean area available for the veterinarian to perform the surgery. Some will actually do a standing C-section where they will use local anesthetics if you have, some kind of a stand or stanchion, or a grooming stand or a stanchion to restrain the animal. So as the breeder, your job is to stand by with plenty of clean, dry towels and a bulb syringe to suction noses, and then to work with your veterinarian and follow their instructions. But any kind of situation where they can't be born on their own, even with assistance, that's when you call your vet for a C-section. So after she lambs her kids, what's next? This is considered stage 3 labor. So she's going to pass the placenta, and this should happen within 6 hours. So if she had a really stressful lambing or kidding, and she seems exhausted, this is when I personally would give a dose of oxytocin, because it's just going to help with passing the placenta. If you don't have a source of oxytocin, massaging her udder will release oxytocin naturally. You need to work with your veterinarian for the correct administration and dosage for oxytocin. And this is a prescription drug, so you will need to get it from your veterinarian. So if she's been working on passing the placenta for 6 hours, you can add some weight to the placenta to help her get it out, but do not attempt to pull it out yourself. That can cause her to hemorrhage. And if it's been more than 24 hours and the placenta is still not passed, then you want to contact your veterinarian. A retained placenta can cause uterine infection and can cause death. So at this point, the lambing or kidding is done. Then you or your doe is going to bond with her kids. And immediately they should want to nudge and lick their babies. So that's showing that they have the maternal instincts that are necessary. It may take a little while, but ideally your lambs or kids will be up and nursing within an hour. Some may take a little bit longer, but they have to have that colostrum within the first 12 hours. If your ewe or your doe had a rough kidding, then she may need some assistance, with taking care of the lambs or kids. Okay, so going back to some of our previous slides, questions. Are these position moves doable while the kid is still in the sac, or will it need to break before repositioning? Typically, the amniotic sac is going to break as you're working with the kid. That just kind of happens. But hopefully, what you want to do is if you are having to reposition a kid, you want to do it quickly so that it doesn't dry out before you can get the kid out or the lamb out. And so in the case where you have a ewe or a doe that does not accept her lambs or kids, then ideally you're going to do it. If you're going to try to graft it onto another ewe or doe, hopefully you have one that is lambing or kidding at the same time, because those hormones are what's going to help them adopt another lamb or kid. If you wait past 12 or 24 hours, for sure, but usually within 12 hours is your main time for the hormones. And so if you're trying to graft them, you ideally want to do it to one that's within 12 hours of kidding so that you can have those hormones. But they need colostrum within 12 hours, regardless of how they get it, whether they get it from bottle or from their mother or from another mother. But you can take an older lamb or kid and graft it onto a ewe or doe that is just kidded. That's a possibility. But that ewe or that doe, in most cases, you'll have some that will let anything nurse, but most of them are only going to accept a new lamb or kid within that first 12 hours after lambing or kidding. And so if you have a ewe or a doe that's just exhausted, giving her a boost, some warm water with molasses or some jumpstart gel or something that has some carbohydrates in it can help, some sugars can help give them some energy. And then just kind of give them some space. Let them have some time to bond with their lambs or kids. But you might have a young ewe or doe that this is her first time. She does not know what these things are. And so she might need a little work and a little assistance to figure out what she's supposed to do. And so you want to make sure, especially in this case, if her instincts don't kick in within an hour or so, you might want to restrain her so they can nurse, so she can kind of learn what it's all about. Because not all of them take to being a mother naturally. And so just you want to make sure you keep an especially close eye on first timers. Okay, and I'll switch it over to Mary to talk about the first 24 hours.
Yep. So our first 24 hours is one of the most important time periods in our new lamb and our new kid's life. So making sure that they get a really good start is going to be key for their success going forward. So in the warm weather, kids may not need a lot of help, or lambs may not need a lot of help or intervention at all. They don't have that risk of necessarily getting cold and things like that. But in the cold weather, which is when we're going to be lambing and kidding, for a lot of our show animals, or just around here, that's kind of the ideal time to lamb or to kid. And so checking and making sure we don't have any newborns born that they're getting too cold out in inclement weather is going to be key. So if you find someone that's cold, go ahead and get them dry, clamp the cord, and make sure those nostrils are clear so that they can get breathing and not get gunk in their lungs. If you're going to be dam raising, so most of our lambs, if you have a dairy sheep or dairy goats, more likely those kids or those lambs are going to be taken away. But if they're going to be dam raised, make sure that that bonding does happen between that dam and that lamb or that kid. Like Sarah said, you can graft within about the first 12 to 24 hours onto a new mom. I always suggest if you've got a new mom that just had babies, take the placenta or that water sac, try to get that scent onto the baby you're trying to graft so that it smells more like, that you or that dam. They're going to be much more likely to accept that new baby. But sometimes they won't. You have ones that just you can't graft onto. If the lamb or the kid is really weak, make sure you get them warmed up and monitor carefully. Make sure if they need assistance, you're getting them tubed or you're helping them nurse, getting them up and standing, and then check on them every couple of hours to making sure that they're still warm, they're still feeding, and they're in the right direction and not going downhill. If you're nursing or bottle feeding, again, if you're pulling them straight off the dam to bottle feed, making sure you have that colostrum replacement, either that powder or you're milking out and providing that colostrum to those lambs or kids within the first 12 hours. The reason it's key in the first 12 hours is because the particles in the colostrum that the animals need to start strengthening their immunity are really big. And so at the first 12 hours, their gut intestines have bigger pores that can absorb those particles. After 12 hours, those pores get smaller and smaller and can't absorb, so they're not getting the immunity that they need out of that colostrum. And so it's just like giving a milk replacer at that point. And so getting the colostrum to them in the first 12 hours is going to be key for their survival going forward. Um, You want to make sure you have your plan set up kind of before. Again, if you're raising dairy goats, you know they're probably going to be bottle fed. So having those pens set up, being ready for that ahead of time, so you're not trying to scramble when you start having babies, will be key. Some ewes they just don't accept it. First time moms, may have had lambs or kids before, and they're just like, nope, not doing it. If they especially if they have a really traumatic birth, it might be harder to get them to accept those babies. So you may have to bottle feed. So it's good to have the equipment on hand so you're ready and you're not trying to run to the store ahead of time. If you're not comfortable caring for weak lambs, make sure you call, your vet or somebody around that you feel comfortable with getting help from. That it's agreed like, hey, you can call me or we can come, take these weak kids or come over and help you with those to try to help get them up and going. Again, making sure the membrane and it's clear of the nose so they can breathe. You want to rub them very vigorously with the towel. This starts kind of getting their lungs to start working and also drying them off and getting them started. Um, Check for a heartbeat to see if there's anything present, and then see if they start, moving their eyes. That's all signs that we do have a live lamb. Um, you know, if they're cold, you want to make sure to get them warmed up again with a heat pad, a water bottle, or a hair dryer, and then give them a little time to kind of get settled. You don't want to immediately go in trying to tube them, especially if they're cold. If they're cold, all of their energy is going to try to warm them up and not, you know, utilize their digestive functions. And so you could be tubing them, it's just not going to do anything while they're cold. They have to be warm to be able to digest and utilize that milk. So get them warmed up, making sure their mouth is warm. Stick your finger inside their mouth, making sure that's warm before you try to you bottle or tube that baby. If the landward kid doesn't stand within an hour, you either some milk some colostrum out and tube it, or bottle feed it if it's strong enough to suck. If they're still not strong enough, you can give them vitamin B complex, and BOCI can help kind of boost those kids. Again, consult your vet for your dosage and the usage there. If nothing's still working, they're kind of lethargic. They're warm, but they're not doing much. Give them a little Caro syrup or that molasses and power punch to try to get them up and going. And then if it's cold, you may have to bring them in the house. We've had some in dog crates before on a heat pad trying to get warmed up. Mom didn't want anything to do with them, and so that may just be necessary in the cold winter months to get them warmed up.
Okay, Mary, we have a question. So
Uh-huh.
once they are dry, will they be able to stay warm on their own? If not, how long do we need to keep them warm before they maintain a body temperature?
Yeah, so that's going to be a case by case basis. And so if they're not eating, getting up and standing on their own, they're not going to be able to retain their and manage their own body temperature. And so you want to go out and feed them regularly, making sure they have that food as long as they're warm, and then just kind of watch them and monitor them. We've had some that we thought, hey, they're doing great. We've got them going. They're standing up and going. And we go out in a couple hours and they're cold again because mom wasn't letting them nurse. So going out, watching it, and making sure it's going to be a case by case basis depending on that ewe and that lamb or that new kid. So additional considerations. If for lambs, tail docking is kind of a contentious subject. Really, it's important though to help keep that animal clean, especially on wool sheep. So wool sheep don't have very good control of their tail, and so they can't lift it when they poop, and so that gets kind of stuck under there, and they can attract things and increase our chances of fly strike. And hair sheep, they have more control over that, so it's not necessary as it is in our wool breeds. It can cause pain during that, but if depending on the type of procedure you do, that's a pretty temporary pain. Um, and sometimes if you dock too short, like I've seen some pretty extreme docking, especially in our club lambs, trying to get that a cleaner hip area. It can cause vaginal prolapses. However, um, there's studies shown that vaginal prolapses are actually more linked to genetics rather than docking too short. Like I said, there are people that take it to the extreme and actually like surgically remove that last vertebrae. That's going to increase our likelihood of prolapse. But usually our vaginal prolapses are going to be tied towards genetics. That's why it's really important to kind of keep those records. If you have a line that's consistently you have trouble with prolapses, look back. It's more than likely going to be linked to one sire. So you should probably get rid of those females as well as that sire, so we're not prolonging that problem in our herd. Some techniques. Banding is probably the most common. And so the band is using a lastrator. You put a band right on those vertebrae, basically just cuts the blood supply off to the rest of the tail. It'll slowly die off. The pain, however, can tend to last a little bit longer than some of the other immediate. They get cut off and they're gone. However, this is probably the one that's most commonly used throughout the industry. Hot blades can be used to cut through the tail and cauterize all those blood vessels. Again, the pain is a little bit less and it's more immediate because it's immediately cauterizing that and then it's gone. You don't have that prolonged period of waiting for that tail to fall off. But that one is, you can get a little more tricky. You want to make sure you're right in the exact spot and have a little more experience with that. And then banding along with crushing. So a bloodless castrator come through and crush the tail for about 10 seconds. After that band is applied, again, that's good. It's cutting off the blood flow from the tail and it'll eventually come off. And it can be a little bit quicker than banding alone. So a little less pain there. Disbudding in goats, again, it's hotly debated because of the pain factor, but it's safer for yourself and those animals. You're less likely to get a head caught in a fence and then potentially starve to death, or a predator coming in and getting it. And you're less likely, if those animals are going to be fighting, to hurt one another if they don't have those horns. But if they do have the horns and they're not caught up in something, they can defend themselves better against predators. If there's something comes up in the pasture or area you have them, as well as they actually use their horns as a cooling mechanism. And so if you get rid of those, you may have issues with heat tolerance, in disbudding. But you just got to weigh the pros and cons on your operations and what's going to work best for you to really determine what you should do for that stage. The castration reasons we do that is because we don't need as many of our males for breeding purposes. Depending on that age, or one male can breed quite a number of ewes or does. So also not all of our males are going to be breeding quality. And so we castrate to help reduce our aggression in the pen. Also, if you don't castrate, you need to separate the boys and the girls so that there's no accidental breeding between sisters or close relatives, and very young ewes or does. We don't need the accidental breeding to occur. If you don't castrate, just make sure you separate those animals. Watch for that aggression. You might have some more damage to your gates or your feeders if they try to fight. But if you manage it well enough, you can get away with not castrating your animals, and depending how long they're going to stick around on your facility. We personally don't castrate until it's either leaving. It's leaving as a show animal, and so we do sell a lot of rams, and then the rest that we sell to market go fully intact. And so it just depends on, again, your operation and what your overall goal is. Surgical castration can be done at any age. So if you have something that's a little bit bigger that banding can't really fit around, you're going to need to go that surgical castration route. If you're not comfortable with this, call your vet to come out and making sure that that's done properly on your farm, so that you're not, potentially losing an animal to blood loss and things like that. Banding needs to be done again when it's quite young, because once those the testicles get too big, you can't fit the band around. Plus, there's too much blood supply there. It's a lot harder to get those cut off really well. You want to make sure the bands that you buy are fresh. Bands are relatively cheap, so go and buy a new supply each year before you start lambing or kidding, to make sure you have plenty on hand. Again, those bands are rubber, they can dry out and crack, and so if you use an old band, you risk the chance of those breaking. You want to make sure you get both of the testicles in the band, and so making sure they both pop through before you clamp down, and you don't have one kind of resect up inside of it. There's also crushing, again, like the tail docking, you can crush. Again, it's a bloodless method, but it's more difficult to ensure that that's completely done. You get both of those securely clamped off, good enough so there's no viability there. So yeah, I don't necessarily recommend that one just because it takes very experience, and again, you've got to do a lot of work there to make sure those are clamped off properly. A vaccination schedule. So CD&T is our main one. We want to make sure that we keep up the dams and the babies up on this. If the dam received prenatal vaccines, there should be enough residual coverage in the colostrum to get those to those first 5 to 6 weeks. And then you're going to hit a booster shot at 9 to 6 weeks. The 6 months, every 6 months isn't necessarily required, but if you have a trouble with anything on your farm, CD&T is pretty cheap. So you can go ahead and dose your whole herd every 6 months just to make sure they're protected. But again, it's not necessarily required. If the dam didn't receive prenatal vaccines, you want to make sure that they're getting that when they're get any sort of work. So castration, docking, disbudding, because you're increasing the risk for tetanus at that point. So making sure you at least get that tetanus antitoxin, and then the CDT at 2 weeks and 6 weeks for sure, but that booster about a month later. If you have any further questions, these are some really good resources that you can go to, or of course you can always contact Sarai or your local extension educator, and they can get you hooked up with somebody that can answer some of your questions. Or if you have a need for a farm visit, or you're just not sure about things, just feel free to give us a call and we can help you through any of those questions.
Okay, we're happy to take any other questions you have. I know we're running late,
Yes,
but
sorry about
there's
that.
a lot of information about lambing and kidding to get in. Yeah, so will this PowerPoint be available to us? Yeah, so I will probably tomorrow post it to YouTube.
Yeah, and I just
Yes, and
reposted
yes,
the link to the presentation in
you
the
just
chat
posted it to
box.
me, so I'll
Oh,
give it to, yeah,
thank you.
I'll do it to everybody. So yes, the presentation is in that folder. And then we would appreciate it if you would fill out the evaluation, and I will post that as well. If you could go just click on that link in that last that I just gave you and fill out, it's a pretty short survey. Just let us know a little bit about your operation and what you learned today, and what you'd like to see us present on in the future. And then again, here are the different links again. And then next week, we're going to have a guest speaker to give forage-induced livestock disorders. So this will cover toxic plants, and it will also cover forage plants that can become toxic. And so it should be a good presentation next week.
There was a last minute question from Amy in the Q&A. If a dam had CDT a month prior to kidding, do kids only need one CDT? If so, at what age? They still do need a booster. It just, you can push that back. And so, can you go back to that slide, Sarah?
Yes.
So instead of doing it at 2 weeks, your first vaccination of the lamb or kid is at 5 to 6 weeks, and then a booster at 9 to 10 weeks. And so that's helpful if you're not, docking or castrating right in those first couple of weeks. You can do that CDT when you do it at 5 to 6 weeks, and then a follow up. So about 4 weeks later, either if you're doing it with the dam is vaccinated or dam is not.
So this presentation will be posted to YouTube tomorrow. Any other questions? I'd like to thank you all for joining us, and we'll see you again next week.